important MCQ question to study. Glaucoma drainage implant associated endophthalmitis is most commonly caused by strep species, coagulase negative species, Bacillus cereus, or mycobacteria. We studied a similar question before about a gentleman who had glaucoma drainage surgery, subscleral trabeculectomy, and he developed inflammation inside the eye around 2 or 3 months post-op. So this was late blebitis endophthalmitis, and we discussed the microbiology at this time. Today we'll study a variation of this question, endophthalmitis associated with glaucoma drainage implants. Glaucoma drainage implants or glaucoma devices associated endophthalmitis. Implants in glaucoma, these devices are usually either valved or non-valved. So we have Ahmed valve and we have Bervelt drainage device. There is a study called Ahmed-Bervelt comparison study, and this proved that the non-valved devices like Bervelt has higher lowering effect on the intraocular pressure. Ahmed valve usually required post-operative topical medicines to control the ocular pressure to the desired level. However, in the same time, Bervelt glaucoma implant had greater incidence of serious complications like persistent hypotony, like explantation, and loss of light perception. At this stage, endophthalmitis is not mentioned. Endophthalmitis usually happens if there is erosion, GDI-associated erosion. And this is the same for the pathogenesis of blebitis-associated endophthalmitis. If there was buttonholing of the conjunctiva, this led to blebitis endophthalmitis. And now if there is erosion above the implant, the tube or the implant, this increases the risk of endophthalmitis. Also, having another surgery performed, especially like associated trabeculectomy, and worse even in mitomycin augmented trab. These patients are at high risk of developing endophthalmitis associated with these implantable devices. However, naive eyes with only glaucoma drainage devices who didn't have any other intraocular surgery, either cataract, who didn't have any other glaucoma filtration surgery previously, they still acquired endophthalmitis. Endophthalmitis in these patients are usually of delayed nature, so it doesn't happen within the first 28 days. And this takes us to our question. So, delayed endophthalmitis from glaucoma implantable devices is usually caused by Streptococcus species. And this is the same of delayed blebitis endophthalmitis, which happens from Streptococcus or Haemophilus species. And the only difference is in the previous question on blebitis endophthalmitis, during the first or the initial 28 days from the procedure, coagulase negative staph epidermidis was the commonest cause. But because glaucoma drainage implant associated endophthalmitis is usually delayed, so the answer is Streptococcus species. This patient didn't have any conjunctival erosion. So this patient has history of mitomycin C augmented trabeculectomy with releasable sutures, followed shortly augmented by a tube, a non-valved implant, and then he presented around 5 years later with mild endophthalmitis, anterior chamber cells, inflammation, cells in the anterior 1/3 of the vitreous, and he had this releasable suture here, broken. So an exposed suture is a track of infection. This exposed suture must be removed. My only concern was, upon removing this releasable suture, the surgeon might have attached it to the second suture, and this might cause troubles while pulling it out. So my plan was either to pull it out or to trim it and bury the remaining under the conjunctiva. Fortunately, pulling this loose suture out, it came out completely and was not connected to any other suture inside.